And welcome to the Dr. Bob Show. We'll be spending most of this show talking about mold and mold harming your health, or does it harm your health? There's mold everywhere. There's inside mold. We've got mold in schoolhouses, in buildings, in crawl spaces, in houses that have had leaks and floods, a cabin in the woods. There's mold everywhere. There's outside mold. When you look at leaves, when you rake leaves, when you're in a barn with hay, there's mold inside and outside. There's always mold in the air, except maybe when there's snow on the ground. So is mold harming your health? My guest is Dr. Laura Green. Dr. Green is a board-certified allergist from Medical College of Georgia, where mold issues were part of their training. She'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about some heart rhythm problems, why some need blood thinners and others don't. Why is that? And if we have time, we'll have other issues from you, the viewer, that will be important to your health. You'll want to stay tuned. We're talking with Dr. Laura Green, board-certified allergist, trained at Medical College of Georgia, and we're talking about mold health issues. Dr. Green, welcome to the Dr. Bob Show. Tell me about mold. Does it cause health problems?
It does. We have mold outside, we have mold indoors, and for people who are bothered by mold or who are allergic to mold, it certainly causes a lot of health problems.
So inside mold, where do you find inside mold, and what's it look like, and what's it look like under the mic? I got lots of questions.
So mold likes to live in places that are dark, damp, and warm. So places in your house that you would look for mold are going to be basements, crawl spaces, bathrooms. If you don't get a lot of natural light or good ventilation, those are perfect environments for mold to grow.
So you mentioned light. Sunlight help keep mold from growing good?
It does, and that's one of the things that you can try, especially in basements. If you do have windows down in your basement, is to try and open up those blinds and let some natural light in.
And if you don't have, maybe there you can put some type of window so they can get sunlight. So what does the mold look like in a house, the inside mold? What's it look like?
It could look a couple of different ways, but oftentimes you see either dark places, mildew in showers, mold in your refrigerators even.
Oh, that's right. And I can remember some times where that's occurred. Are those molds dangerous to your health?
Molds can be dangerous to your health. Mold produces tiny little spores, and they're very small, relatively speaking, especially compared to pollen granules. Molds are very, very tiny, which means that they can penetrate the upper airways and the lower airways much better, making them a potentially bad allergen for people who are allergic.
So can you see that mold under a microscope? Does it have they have different molds, different shapes, different problems?
They do. They all look different under a microscope, and that's how we identify which ones are in the air and which ones can be in your houses, because we can look at those and distinguish the difference.
Are there some common inside molds that are different from outside molds? Are they usually the same? Let's talk about inside. What do we find inside the house? What kind of molds?
So the most common molds that you'll find in the house are going to be Cladosporium, Penicillium, Alternaria, and Aspergillus.
Okay, Penicillium, does that have anything to do with penicillin?
Yes, they are similar, and you will find Penicillium especially in your refrigerator, so that may be one that you find on moldy fruits or things that have been in your refrigerator too long.
And you mentioned Cladosporium. Is that a common mold inside the house?
It's a very common mold inside the house, and one of the big reasons is because it's one of the most prevalent molds outside, so it blows into the house because it's present in such large quantities outside.
Is there more mold in houses or other buildings? How about school buildings? How about office buildings? How about cabin in the woods? All those, to me, seem like they'd be set up for mold.
They are, and a lot of people don't necessarily notice mold in their homes, but you will have mold in school buildings, or especially old damp buildings. If they have flat roofs that don't drain well, the water sits on top, or if you have leaks, those are prone for mold.
You know, in my experience, schoolhouses have the flat roofs and they've all got leaks and they've all got mold and everybody complains about it, but we don't have enough money to remediate that, to take care of the mold that's there. So what do we do in a schoolhouse that has mold issues?
The biggest thing would be to identify the water source where the leaks are occurring, to, like you said, remediation. You have to stop the water, you have to get it dry so that you don't have as good of an environment for mold. Dehumidifiers, making the air less humid so that mold doesn't grow as well. And then cleaning mold. You have to get the mold spores out with cleaning agents. Those that contain bleach are often effective.
Is that a simple way to get rid of the mold, or is it something you just got to keep working on it, just keep working on it?
You have to keep working on it.
So if somebody has mold spores in their house, is there mold in every house? If you put out a culture plate for mold, would it grow mold in almost everybody's house?
It would, because you're going to get some coming in from outdoors. So you will see the mold spores in your home. Even if you are very good at keeping your air dry, you don't have a leak somewhere, you'll have mold coming in from outside.
And tell me how those mold will cause allergy problems.
So when you breathe in mold spores, just like for people who are allergic to pollen, you breathe them into the nose. They cause early symptoms of itchy, runny nose, and then several hours later you're going to have nasal congestion, which is more of a later phase reaction. You can have upper airway symptoms. For people with asthma, they have lower airway symptoms, and mold spores are very small, so they penetrate the deeper airways better, which causes a big problem for patients with asthma.
So what are some of the symptoms of asthma that due to mold that's in a house, that's there all the time, especially, you know, at nighttime when somebody goes to sleep? What are some of the symptoms they have inside the house?
You're going to notice a lot of trouble with your breathing, so shortness of breath, cough, maybe you hear yourself wheeze. Nighttime cough that wakes you from sleep can be asthma. It can be other things, but asthma should be in the differential, especially if you notice daytime symptoms as well with cough and wheezing.
So people have wheezing, they have cough, chest feel tight, do they smother? Do they feel like something's happened? Do they wake up and think they've got a panic attack, or do they recognize it's asthma? If I woke up in the middle of the night and I was wheezing, had a tight chest, I'd be scared. Is it scary?
It's scary, and you could mistake it for a panic attack or an anxiety attack, but this will make your chest feel tight. It'll make you feel like you're not getting air in well. And the biggest problem with asthma, it's an obstructive process, meaning that you don't blow air out of your lungs as well. But the thing that goes along with that is that you have air trapping, which means that your lungs expand and you don't breathe air in as well because your lungs are overexpanded.
So part of the treatment is going to be able to take care of that. But if somebody wakes up in the middle of the night, cough, wheeze, tight chest, and then they wake up in the morning, and do they get better sometimes during the morning? Go to the doctor's office and say, I was wheezing last night. And he said, well, you sound fine today.
They may feel better because they aren't around as much mold. So if you have a lot of mold in your house, particularly in your bedroom where you're spending the night, and you leave your bedroom, you go into your car where you don't have mold, your symptoms may improve a little bit.
So it causes allergy problems, stuffy nose, runny nose, sneezing. And later on, you said, how long after the initial insult to the nose does you get the congestion and the sniffles and the snorts and the blocked head and the sinus pressure? How long after the initial reaction?
It's going to be several hours later, so you're looking at 4 to 8 hours later, more stuffy nose.
So somebody could be exposed to mold during the day and really have problems later on at night?
Correct.
And then they could have it at nighttime from the mold that's in the air?
That's right.
So it's a big problem.
It's a big problem.
Can you identify from an allergy standpoint whether somebody's allergic or not?
We can. Allergy skin testing is very useful for helping us identify patients who are sensitized to molds.
And that's what we're going to be talking about when we come back. Skin testing is very, very important in deciding whether or not somebody is sensitized to mold, or if it's something else like a dog or a cat in the house, or maybe they just wheeze at nighttime. A lot of information for you. You're going to want to stay tuned. Great information. We're talking with Dr. Laura Green, allergist trained in mold problems, and we've been talking about inside mold, where any place that's damp and dark and has that moisture, you can grow mold, and that mold forms spores, and the spores are very small. You can breathe them into your nose, all the way down the lungs, where they can cause nose allergies or lung allergies. And we can identify that by
skin testing.
Now, what's skin testing like?
Allergy skin testing is pretty simple. We bring patients in, we do skin testing with little scratches on the back to start out with, and within 15 minutes, we start to see whether patients develop red, itchy spots like mosquito bites, and those would be things that are positive.
So a positive skin test can identify different molds or just mold?
We test for a pretty wide range of molds.
So it can identify the specific ones that are causing problems.
Yes.
And then how do you figure out if that's the one that's inside the house or not, or if that's one that you usually find outside or inside? How do you take that information and decide if it's probably the culprit?
So we look at their history compared to what they're allergic to, and we know that a lot of molds are more common inside. We also have a lot of molds that would be present outside, especially on wet, rainy days. Ascospores, basidiospores, those are ones that we see outside when it's more humid or when we've had a lot of rain.
You must have had a lot of good training to say words like basidiospores and that type. So they all cause problems. They're in family of mold that can cause allergy problems. And you can identify them by skin testing.
We can.
Then what do you do? If you identified it, what do you do for it?
Once we've identified it, we can optimize treatment of patients who haven't responded well to initial therapy with medications, and we can start them on allergy shots.
Allergy shots, what do they do as far as mold goes?
We can help desensitize patients to molds or to things that they're allergic to, or help them build tolerance to these things by giving them increasing amounts of allergy shots and concentration over a period of time until they reach a maintenance dose, and then they can stay on that maintenance dose long term.
So if somebody breathes in mold, they sensitize their nose and lungs, and the allergy shots desensitize, build up tolerance.
Correct.
That way. I have patients that come in, and you mentioned earlier that the black mold, and they still talk about the black mold. What is that? What does it do?
So black mold is Stachybotrys.
Stachybotrys.
Correct. And it's a blackish green mold that's in houses, and it loves to grow where there's been a lot of water damage. There have been case reports in the past that suggested that Stachybotrys may have been related to infant pulmonary hemorrhage or to memory problems. And those are really scary things for patients, especially if you get online and you start looking things up. I think it's important for patients to realize that those findings have really never been duplicated, and there's not a lot of good evidence to back that up. Now, Stachybotrys can cause allergy problems just like any other mold, and that could cause a problem for patients with asthma or with nasal allergies.
So what we've got to do is dehumidify, get more light in there, make it drier. A dehumidifier, what humidity do we like the house to be?
We would like to set a dehumidifier at about 40 to 45%, and that will create an environment that's just too dry for molds to thrive quite as well.
Now, I've always heard patients, especially with young children, who will put a humidifier in a room so that they'll be able to breathe better and the air will be moist and it won't be dry. Are humidifiers sometimes dangerous as far as mold goes?
They can be. Now, we know that cold, dry air is worse if you have asthma, but at the same time, if you have allergies to mold, and mold is what is a big trigger for your asthma, you want to be careful about that, because as you humidify an environment, it does create the optimal conditions for mold to thrive.
If I remember also, when you get increased humidity, dust mites, which
That's
cause
correct.
house dust allergy, also grow very well. And so
They do.
You're creating an allergy atmosphere if you use humidifiers. Dehumidifiers. Should you have central dehumidification in your air conditioning for your whole house, or you just put one in a room?
You want to at least concentrate on your bedroom, because you spend about a third of your day in your bedroom. What might be also beneficial is to install a HEPA filter HEPA filtration system for your home to filter out some of these things.
So HEPA, HEPA filters, you can get those at any large department store, a Lowe's, a Home Depot, that type of situation.
Right.
Ace Hardware. Don't want to not mention one of the stores. So HEPA filter, that takes out the particulate matter in the bedroom and helps clean the air. And then dehumidifiers help if it's a moist, damp setting. Allergy shots effective in building up tolerance and desensitizing to mold.
Yes, they are effective.
So while you're waiting for the allergy shots to work, what medicines can you take for your nose?
The number one very best medicine that you can use for your nose is going to be a good intranasal steroid.
Intranasal steroid, example of one. You can name those on the Dr. Bob Show.
So Flonase, Rhinocort, Nasacort.
What do they do? They're not antihistamines. What do they do as far as the allergic response?
They help with both the immediate phase response and the late phase response of an allergic reaction. So they're going to help decrease reactivity to things that you're allergic to.
So if you had one medicine, the intranasal steroid would be one.
Correct.
How about the lungs? Now the lungs, you say go into spasm. What do you have to do for that? Just use a bronchodilator and that's all?
Some people can use a bronchodilator as needed if they only need it a couple of times here and there. If you're needing it more than a couple times a week, you really need to be on an inhaled corticosteroid.
So an inhaled steroid, it goes down to the lungs. What does it do? Same basic thing as the nose?
Same basic thing as far as helping decrease your hypersensitivity or your reactivity.
So let's jump to some cases where mold can cause some problems, and you know what I'm thinking about. There's an ABPA or there's a thermophilic actinomycetes. What would those be? So let's talk about thermophilic actinomycetes. What's the problem?
Now we see that a lot in hypersensitivity pneumonitis, and we also call that farmer's lung. So people that are especially farmers or who are in silos and around moldy grains, they may encounter this and develop a specific type of lung process known as hypersensitivity pneumonitis. And this is different than asthma. This may present early on as fevers, bad cough, chills, and asthma doesn't necessarily present that way, so that's going to be different. Over time, if left untreated, it can cause fibrosis of the lung, which is a big problem.
So that would be in a silo where they've got corn or wheat, a barn that stores wheat. Would that be a bad place for mold patients?
It potentially could be.
Are there ducts inside a building that can have that thermophilic actinomycetes?
They can.
So it can cause, if somebody is having cough, tight chest, wheezing, short of breath, fever, fingers are turning blue, something bad's going on,
Right.
We need to think about air conditioning units. So what's the other one, APBA?
So ABPA,
ABPA.
or allergic bronchopulmonary aspergillosis.
Now that's big, long things.
It is.
Acute, that means sudden. Bronchopulmonary, that's the lungs. Aspergillosis, that's aspergillus. Is that one of
Yes.
the molds you mentioned?
So this is one of the molds we mentioned about being common indoors and also outdoors. And when patients get ABPA, they become colonized. Their airways become colonized with aspergillus, and it causes a lot of problems. Again, mucus production, and it's usually patients that have asthma, but also patients with cystic fibrosis are at a higher risk.
So the trained allergist has to be able to have a differential diagnosis. Take away from mold in a house or mold in a building, the problem is usually allergy, or it's usually something else that mold is causing.
Mold will generally cause problems with allergies. That's going to be the most common thing.
And so you can diagnose it and you can treat it. You've really cleared this up for me well too, Dr. Green. I want to thank you for coming to the Dr. Bob Show. It's a great discussion on mold, which scares a lot of people, and justifiably so. But it's most likely allergy, and there's some things that we can do about it. Thank you for coming.
Thank you.
I hope you enjoyed that as much as I did. Mold can cause severe indoor allergy problems and outdoor allergy problems. You're going to want to stay tuned. Later on, we're going to be talking about other health issues, heart rhythm problems. Why do some people need a blood thinner with that? And why do others not need blood thinners? How does the doctor know what to do? You'll want to stay tuned. I want to thank Dr. Laura Green. Wonderful discussion on mold issues with your health. Know that it can be diagnosed and it can be treated. Now, questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. I've been having some extra beats in my heart, some fluttering of the heart, and my doctor says I've got a rhythm problem and it's going to need blood thinners. Aren't blood thinners dangerous? Well, there's no free lunch. Yes, blood thinners can be dangerous. Usually, heart rhythms, problems may be just extra beats, and frequently they're not due to something dangerous. However, if your heart races away, the doctor has to find out if that problem is atrial fibrillation or not. Because atrial fibrillation is the most common chronic, long-standing rhythm problem that we have. And with atrial fibrillation, one of the chambers of the heart just sits and wiggles, and when it does, the blood is stagnant. When the blood is stagnant, it forms a clot, and then that clot ends up going out the big pump, and the first place it goes to is the brain. 25% of people that have atrial fibrillation will get a stroke. So blood thinners are very, very important. We used to use warfarin. Sometimes, if we can, there are other blood thinners like Eliquis that we can use that may be better. Your doctor will have to decide that. And so if you've got a rhythm problem, it's atrial fibrillation. Well, what about the other rhythm problems? Most of those do not need blood thinners. So know if you've got a rhythm problem and your doctor says blood thinner, be afraid not to use it. Don't be afraid to use it. But know what the side effects are of that. And so know where bleeding problems can be and what problems you can have with that. Question number two, Dr. Bob. What's a TIA and why is it so dangerous? Well, we're getting into different problems with the central nervous system on the question and answer here. A transient ischemic attack. That's where there's a short blockage of the blood flow to the brain, short period of time where somebody has signs of a stroke, FAST. You've got to know that your face asymmetry, that one arm will get weak on you, that you get numb on one side. If you've got those and slurred speech from one side, be sure you call 911. Get to the doctor quickly because there are medicines that can take care of that stroke. But a transient ischemic attack may just last a few minutes or even an hour by itself and automatically goes away. What do you do about that? Well, you pay attention. You have to find out what the cause is. You have to find out if it's that atrial fibrillation that we just got through talking about. 25% of strokes are that way. Sometimes people don't know when they get atrial fibrillation, and so the doctor has to put monitors on. He has to find that. He has to evaluate the heart. They have to evaluate why somebody is having some problems. Is it hardening of the arteries? They'll get an ultrasound to make sure the arteries are open and clear, and that will have to be taken care of if that's a problem. So the doctor, then we start saying, hey, everything works out good. You're going to have to exercise. You're going to have to watch what you eat. You're going to have to be sure that you watch your cholesterol, diabetes, high blood pressure. Those are the risk factors that we have of stroke. And so it's not a simple thing. So if you have sudden blindness, slurred speech, and it goes right away, don't think it was nothing. Check with your doctor about that. It would be so, so important to your health. And now that's all the time that we have for this show. Remember the things we like to talk about. Number one is exercise is so important. Get your tennis shoes out, start going for a walk. Walk a little bit further every day. No pain, no gain. Well, if you're younger, then we need to work out too, but talk with your doctor about how much you can. If you've got medical problems, but you know, if you exercise, it will cut down your blood sugar, cut down your blood pressure. So know that exercise is the best thing you can do for joints, for stability. Eat properly. We all know what we should eat, but it should be vegetables. It can be a DASH diet. It can be antioxidants. You can learn what those foods are, and less red meats or no red meats. So now we're talking about fish. We're talking about vegetarian type diets, Mediterranean diet, DASH diet, that's diet against high blood pressure it is. So Google those, eat vegetables, low salt, enjoy eating and eat properly. It's very simple if you do it right. And then we need 7.5 hours of sleep. I can't tell you how sleep is beginning to correlate with illness, with high blood pressure, with heart attacks, with rhythm problems and disturbances. And so the cardiologist may want a sleep study. The allergist with asthma or the lung doctor may want a sleep study. Or somebody that's snoring, that stops breathing, sleep apnea, may need that sleep study. So be sure and pay attention to sleep. Learn how to go to sleep. Learn how to get your sleep. But most of all, what is it we like in the Dr. Bob Show? Is that laughter in your life. You know, find that person you love and be able to giggle and tell funny stories, and you'll laugh a lot. You'll be amazed at how much that can do for you. Laughter is maybe the best medicine you can have. So laugh a lot, giggle a lot, and you'll stay healthy.